Hi, everybody. Welcome. I'm Leslyn Keith with Lipedema Simplified, and here to talk about our event coming up this coming weekend, the Lipedema Congress. But I wanted to give everybody an opportunity to meet some of our sponsors and collaborators. And I have here with me today is Tamzyn Murphy with the Nutrition Network. And I'm so thrilled to have you here, Tamzyn, because I've been involved and a member with Nutrition Network almost from its inception. So it's a wonderful organization, and we're so thrilled to collaborate with you. Can you tell everybody a little bit about yourself?
Yes, Leslyn, we're so excited to collaborate with you as well. You know, I recognize your name from at Nutrition Network. We have this members platform where healthcare professionals, coaches, doctors, dietitians, lay people who are health enthusiasts all get to kind of collaborate, present their case studies, bounce ideas off each other, and get all these toolbox items and things. And that's where I really got to know your name, Leslyn. So it's such an honor to get the chance to actually speak to you and speak to your audience, and which we will speak about in a little while, actually collaborate with you guys on a lipedema training. But before we go into that, I suppose let me introduce myself. I am Tamzyn Murphy, as Leslyn said. I'm a registered dietitian and head of content at Nutrition Network. And Nutrition Network, in case any of you are wondering what we do, we are an online training platform. So basically, we offer courses generally in the vicinity or area of therapeutic carbohydrate restriction, but we go wider than that. So also looking at other biohacks, if you will, or lifestyle modulators or moderators, whether that be exercise, sleep, stress, circadian rhythm, infrared light, whatever it is. You know, we are very science-heavy, science-based, evidence-based. And initially, we actually started out just training doctors and then eventually healthcare professionals, because I don't know, many of you might know Professor Tim Noakes. So Professor Tim Noakes is a very big name here in South Africa, where we were founded. And he was the guy who is a very world-renowned sports scientist and professor at the University of Cape Town, here where I live. And then one day he suddenly started saying everything he said was wrong, and we need to stop eating carbs, and that he had gotten diabetic, and that actually the book that he read, The New Atkins for a New You by Westman and Volek, that's actually very evidence-based, and he reversed his diabetes using this. And then he started on this whole, in South Africa it was initially called banting, but he realized that actually carbohydrate restriction can work really well for diabetes, and he started diving into how it can work for other insulin-resistant conditions. And in so doing, he founded this organization, a non-profit organization, which its focus was on, or is, on research, funding research into the area, because research in the area was so sparse. He wanted to, coming from a very research-heavy academic background, an A1-rated scientist, a professor, he was like, no, he wants to fund and promote research in the area. And so that's why he founded the Noakes Foundation. And I actually studied my master's with partial funding from the Noakes Foundation. That's how I got into the space, with Prof. Tim Noakes as my supervisor at the time. And then actually it was the year that I graduated with my master's degree. We had lots of questions coming into Nutrition Network saying, where can we find doctors? Where can we find dietitians? Where can we find coaches who can actually help us on this lifestyle that we've chosen, this lower carbohydrate, therapeutic carbohydrate restricted lifestyle that we've chosen? And amongst those were actually the people who had volunteered to be in my master's degree project, in my study. Because in my study, we looked at 30 diabetics who had put their own selves into remission using therapeutic carbohydrate restriction or ketogenic diets. Not all of them were ketogenic, so low carb diets. But they had put themselves into remission without the support of any healthcare professionals. All they did was go and search the web and try and figure out the truth from, the fallacies. Right. And somehow they still managed to achieve the amazing basically 75% of them we confirmed were in remission from diabetes. But they didn't have the support. And then we had queries pouring in at the Noakes Foundation saying, who can we go to? How can we get support? How can we put our diabetes into remission? And other things, polycystic ovarian syndrome, metabolic syndrome, blood pressure, those chronic diseases, metabolic syndrome things. How can we do it? And we were like, well, we don't know. We don't know which doctors to refer you to. We don't know which dietitians, psychologists, which health coaches will support you in this. Which cardiologists are not going to put you onto a statin straight away and tell you cholesterol's bad. We just don't know. And that is why in 2018, we decided, well, we better sort this out. We better fill this gap. And that's what we did. We set up basically this organization called Nutrition Network as both to fill the gap where clinicians weren't trained in an evidence-based systematic way, and then also as a partial funding revenue for the Noakes Foundation's research. Because, being a nonprofit organization, the Noakes Foundation is all nonprofits. They're constantly trying to find funding, and it's not easy. So to know that at least part of the funding would be, a done deal coming in, that can also help with the nonprofit research. So that's why Nutrition Network was formed in 2018. It was launched in 2018 with a summit, with a symposium in Cape Town. And since then, we've just grown amazingly with such incredible interest from the public at large and healthcare professionals who really want to get trained. We have actually trained, I actually got some stats up before this. We have reached now more than 94 countries, and we are training in more than 6 languages. And we've trained nearly 10,000 practitioners, healthcare practitioners globally through our programs.
Amazing.
And so it's really, really grown. And now we have a whole lot of, I actually don't know the numbers. This is where I dropped the side. But I think we must be going on almost 100 coaches and medical practitioners who have actually gone through our full certification pathway, which allows them to be certified Nutrition Network practitioners. So then we know that they have really followed, they've been through a certain number of the courses, and then they follow this intensive in-person, well, it's not in-person, it's online, but with live sessions and marked work and things like that, and final assignments, the certification path right at the end of having done a certain number of trainings, and they can do this. And then we, as lecturers, we get to meet with them, we get to assess them, we get to train them in person online. And then we really know that they are absolutely the practitioners that we want to be referring patients to, and who know how to practice safe and effective therapeutic carbohydrate restriction. And
that has been a huge resource for even our community, our patients with lipedema, because almost the trajectory has been very similar with Lipedema Simplified, and we really became interested in how can a ketogenic diet help patients with lipedema. And around 2015, not knowing that there was some practitioners that were implementing it regular basis already, specifically Gabrielle Ferber in Germany. But at that time, it was just starting to become known, and there's been an explosion of research in that area of patients with lipedema using carbohydrate restriction and having amazing results. And so to have a place to refer people to, that they could be monitored and coached and supported in changing this way of eating is huge, because it can be a daunting task to change your way of eating, sometimes very radically from what you're used to doing. And to have that support, and knowing that it is from a healthcare professional, from someone who's trained and understands. But now we're coming to the idea of there's a gap. And is there an understanding about lipedema? We know you've got lots of practitioners who are very well versed at using carbohydrate restriction, but do they know about lipedema? So one thing that's going to help with that is that we have this medical textbook that is coming out, beginning of next year. And this, our Congress that's coming up this weekend is an event to invite we have over 30 international authors that contributed the textbook, and they'll be presenting at our event. It's a virtual event, September 26, 27, 28. And so it's an opportunity to meet those authors and to see what is going to be in this textbook. We think it's going to help guide the medical professional, but also we know that people with lipedema are going to want this book too. And so we are so thrilled to be collaborating with Nutrition Network on this event and some also future projects that we already are working on, because we're finding out how central nutrition is to managing lipedema. So that has been a huge step forward in people with lipedema. It's almost been this turning point. We thought maybe about 10 years ago that surgery was the magic pill. We could take away the condition, it would be reversed with surgery. Turned out not to be true. It certainly has a place in lipedema care, but it wasn't the total reversal that we expected. We're starting to see that nutrition coupled with other management techniques can be really central to halting the progression and hopefully reversing the symptoms pretty significantly. So it's huge for us to collaborate with you, Tamzyn. Thank you so much for your work.
Well, I'm so excited to collaborate with you. We are so excited to collaborate with you. Leslyn, can we tell the audience what exciting project we have in the pipeline together?
Yes, please do.
Okay, awesome. So this is really exciting. I actually had my first lipedema client as a dietitian in, I think it was 2016. And it was the first time I'd ever heard of it. And, she obviously just sent me on this research voyage of my own at the time, into kind of what to do about it. What does the literature say about it? Could it help? And it looked like it could. And, she actually was so successful with it. I won't say her lipedema is gone or anything like that, but she managed to lose so much weight and centimeters, around the thighs and leg area and hips area as well. Still lipedema, but amazing results. She was so incredibly happy that she made it into one of the leading South African health magazines as well. And I'm just so incredibly proud of her to see her glowing, healthy, happy, able to move more easily, able to be proud of herself in her body. And that was the first time I realized, oh my goodness, firstly, lipedema exists, and secondly, I started seeing it everywhere. I looked around me and I saw so many women with it. And I thought to myself, they probably don't even know what it is, what they have, why, they are the way they are. And it broke my heart because I thought to myself, they certainly, if they don't even know what it is, they don't know what to do about it. And most practitioners, firstly, don't know what it is, or at the time didn't know what it was. And certainly didn't know what to do about it. And I was taught by a patient, and I think it's so amazing that now finally, listen, I remember, I think on our Nutrition Network platform, you mentioned at some point wanting to kind of, when are we going to have training? What are we going to do about this? And we didn't have that to give you at the time, but now we are going to fill that gap together. With you and with us. We are going to launch a training for healthcare professionals, a course that healthcare professionals can do, a systematic course with specific topics, specific modules, very much in line with your textbook, very much evidence-based and in line with your latest publications, so that healthcare professionals don't have to be like I was back in 2016, like a headless chicken running around trying to find the literature, trying to find how to actually manage this condition.
Right. Yes.
But instead, they will have evidence-based guidelines in a systematic layout with toolbox items so that they can really effectively and confidently help their patients with lipedema. So very exciting. You guys must watch this space.
Yes. Yeah, we'll be announcing when that training is available. But please check out Nutrition Network to find out all their huge lineup of all kinds of wonderful courses. And I got to give kudos to you, Tamzyn, because at the time, all the literature said lipedema is unresponsive to diet and exercise. And they blanketly said any kind of diet because they were assuming it was going to be a low fat, low calorie diet. And so you as a dietitian exploring what to do with that patient in 2016 when there just wasn't information available, for you to say, well, let's try carbohydrate restriction, that was brilliant. And I'm so glad that it was so successful.
Well, I can't even take the credit. It was my patient. My client, she came to me and said, I want to do this. I've heard it's helping women with lipedema. And I was one of only 2 dietitians in South Africa who practiced therapeutic carbohydrate restriction at the time. Keto diets at the time. I was one of the first 2. So it was obvious that she was going to go to me or my colleague. So so it was really her. I learned from her, and her success taught me so much. And I can't even remember what the literature said at the time, to be honest. 2016, now almost 10 years ago. So, but I do think that there was some evidence that it would help, whether that was maybe mechanistic through, I can't remember, lymphatics. I can't remember exactly what I had read at the time, but I feel like there was something that made me think it might help. And at the very least, it would help her lose some weight, because she also needed to lose weight in general. So, and she had some signs of insulin resistance. So I thought, well, for those indications, it certainly helps. So let's see if it helps with the lipedema,
Right. Yeah, it was a logical step to take, but unfortunately not a lot of people had taken it. At that time, Gabrielle Ferber in Hamburg, Germany, was doing it with their patients with lipedema, but I don't think she had any publications until maybe 2017, 2018. So you were, breaking ground because there was no connection between the people that were trying it and being successful. Somehow your patient had caught wind that it could work. And so I wish you had done a case study on her, because it sounds like she really had wonderful success. And that's kind of where we started, was doing case studies.
I had in hindsight.
Yes.
That would have been awesome.
Yeah. There was one great one out of Italy that was a case study, 22 months of using a ketogenic diet with a patient with lipedema. And they did it, they wonderfully kept a lot of data, blood work and body composition and body measurements and measurements of her pain. And, just looking at the photos, you think this is spectacular. I would think if I had that condition, I would want to try this out, because that one case study and yours as well were just so spectacular, something that hadn't been achieved before people tried restricting carbohydrates.
Yeah, exactly. And I think, the fact that she ended up in a magazine, at least within South Africa, I do think that, I should have published so that other healthcare professionals could have known what worked. But I do think at least, even if it gets out into the lay kind of public, that something works, that's also helpful. And that's where I think, we actually need to pay more attention to the people on the ground, the patients, the clients.
Right.
The people who are struggling, because often that is where the gyms come from. That is where, if you look at the carnivore space, for example, I think the first really big study was that giant survey of like almost 500 people, where they were just reporting what they had experienced on a carnivore diet before it, had any clinical guidelines or anything else out there. It was the people speaking. And, I think that comes from a very traditional place with humans, right? We used to communicate word of mouth, whether that was like, let's say, if you think about having a baby, for example, you think that the mothers or the aunties or the friends would say, oh, this worked for me, this didn't work for me. And it was kind of shared wisdom. And I think in the kind of medicalization of everything, especially in the baby boomer era, we have forgotten the value of the anecdote. We've forgotten the value of the actual person in front of us. And we think that we can solve everything just with our thinking brains. and ignore the evidence in front of us of what's actually happening on the ground.
Right.
And I think that can really be powerful. So as practitioners, I just like to encourage all of us to remember not to be too narcissistic in all of us. I myself will be like, oh, well, the evidence hasn't shown that, or there hasn't been a randomized control trial for that. But if you are seeing evidence of it right in front of your eyes, then you must listen. And then hopefully the research will follow, because there is a hypothesis right in front of you, and it worked for at least one person. And so I'm so glad that finally we're at the point with lipedema, almost 10 years down the line, where you're publishing, you're getting this textbook out, you're holding this congress, and then we can really launch a professional training that can guide practitioners to help their patients in an evidence-based way. Do you want to tell us a little bit, Leslyn, about some of the content, some of the lectures that we're thinking of having in the training?
Oh, sure. And I wanted to speak to just something you were just talking about the anecdotal evidence and listening to what the patient is telling you. Because one of our authors in the textbook is Dr. Matthew Carmody, and he has two chapters in the book. One is about the challenges that a primary care provider may face when he's trying to adequately care for the patient with lipedema. And what he says in that chapter is the wisdom is in the patient. And sometimes we are not working with what the patient knows about her own body. And so, when we listen to the person and help them, put some pieces together to understand more of what's happening with them, we can come up with some better alternatives. We can optimize their care much, much better. So I think that's what you were speaking to, is that, sometimes we come from, I'm the trained professional, I have information to give you, and it just needs to happen in that one-way street. And it really needs to be a collaboration. We can figure out what to do much better if we work together. And the other chapter that Dr. Carmody has is using the holistic approach and looking at more than just the physical symptoms, because any health, just your quality of life in general, is going to have many aspects, and it's going to have social and psychological, mental, spiritual, all these aspects. And one thing that you do at Nutrition Network is you're talking about, it's more than just nutrition. You're looking at sleep and exercise and, all these things that come together for health. And so I really feel like our two organizations were so well aligned, and I'm so excited to work with you on this project to bring make this collaboration be for the betterment of the lives of women with lipedema. Thank you so much, Tamzyn.
Absolutely. Leslyn, thank you so much. It's been such an honor to be here and speak to your audience and to work with you.
Thanks. And everybody, take a look below. There's a link to come to our event. It's virtual, so you can watch from the comfort of your home. It's happening this Friday, Saturday, Sunday, 26, 27, 28. Be sure and sign up, and we'll see everybody there. Thank you again, Tamzyn, for being here.
Such an honor. Thank you. Thank you.
Bye-bye.